Let me ask you something personal. If you're over 60 and taking blood thinners, have you ever quietly wondered, is it still safe to be intimate? You're not alone. Every week, seniors tell me the same fears. What if I bruise too easily? Could I start bleeding from something as simple as closeness? Or even worse, should I just give up intimacy altogether? These are real, honest questions, and yet most people feel too embarrassed to bring them up at the doctor's office. But here's the truth. Blood thinners don't have to end your intimacy. In fact, with the right knowledge, you can protect your health and your closeness at the same time. So in today's conversation, right here on Men's Vital Health, Wellness Wisdom, I, Dr. Emily Carter, am going to guide you through this sensitive but important topic, blood thinners and intimacy, how to stay safe without losing connection. We'll explore why blood thinners are prescribed in the first place and why they matter for your heart, the unspoken fears seniors carry about intimacy while on these medications, what the science really says about risk, safety, and performance, practical steps you and your partner can take to stay safe without losing closeness, and finally, how to protect not only your health, but also your confidence, your relationships, and your joy. Because intimacy after 60 isn't just about physical connection, it's about love, trust, and living fully. So let's begin this journey together. First, let's understand why so many seniors are prescribed blood thinners in the first place, and how that sets the stage for everything that follows.
Act 1. The promise of blood thinners. Before we talk about intimacy, let's pause for a moment and understand what blood thinners actually do, because this is where the story begins. If you're over 60, chances are high that either you, your spouse, or a close friend has been prescribed a blood thinner. Medications like warfarin, Eliquis, Xarelto, Pradaxa, or even a daily aspirin are among the most common prescriptions for seniors worldwide. Why? Because as we age, our blood vessels and our hearts change. Some people develop atrial fibrillation, an irregular heartbeat that can cause dangerous clots. Others have stents, heart valve replacements, or a history of stroke or heart attack. In all these cases, blood thinners literally save lives. They keep your blood flowing smoothly, preventing clots that could otherwise travel to the brain, the heart, or the lungs. Think of it this way. If cholesterol and plaque are like traffic jams in the highway of your arteries, then blood clots are like sudden accidents that stop traffic completely. A clot in the wrong place at the wrong time can mean the difference between life and death. Blood thinners help prevent those accidents. Now here's something important. Blood thinners don't actually thin your blood in the way most people imagine. Instead, they make it harder for blood cells to stick together and form clots. This lowers your risk of stroke and heart attack. But it also means your body bruises more easily, and it takes longer to stop bleeding when cuts or injuries happen. And that's where the connection to intimacy begins. Because when a medication makes your body more sensitive to bruising, bleeding, or injury, you might start to wonder, is sexual activity safe? Could something as natural as lovemaking cause harm? What about minor accidents, a scratch, a bump, or a little roughness in the bedroom? These are natural questions. And they're exactly why so many seniors quietly carry fears about intimacy while on blood thinners. But here's the encouraging news. Blood thinners are not a sentence to loneliness. They are a tool to keep you alive. And when you understand how they work, you can adapt your lifestyle, including your intimacy, without losing closeness. So now that we understand the purpose of these medications, let's move into the part that rarely gets talked about. The hidden fears and anxieties that seniors carry when it comes to intimacy and blood thinners. Because before we can find solutions, we need to bring those silent worries out into the open.
Act 2. The unspoken fears around intimacy. Now that we've uncovered why blood thinners are prescribed and how they work, let's talk about the side of the story that's often left in the shadows. The fears that creep into your mind when it comes to intimacy. For many seniors, the questions start quietly, almost as whispers. If I bruise just from bumping into the coffee table, what might happen during intimacy? Could I bleed in a way that embarrasses me, or worse, puts my health at risk? What if my partner notices marks on my skin and worries that they caused them? And these worries don't just live in the body, they live in the heart and the mind. 1. Fear of bruising or bleeding. It's no secret that blood thinners make your skin more fragile. Something as simple as light pressure can leave behind purple marks. Many seniors tell me they're afraid that intimacy could cause bruises on their arms, thighs, or chest. Bruises that don't just fade overnight, but linger as visible reminders. And then comes the deeper fear. What if bleeding starts internally? What if I can't stop it? In most cases, intimacy doesn't cause dangerous bleeding, but the fear itself can be powerful enough to hold people back. 2. Anxiety about hurting a partner. For couples, it's not just about self-concern. Many men worry, what if I accidentally hurt her? Many women wonder, what if he feels guilty for leaving bruises on me? That kind of anxiety can change the entire tone of a relationship. A moment that's meant to bring closeness suddenly becomes clouded by hesitation, second-guessing, and fear. 3. Concerns about sexual function. For men, another unspoken worry is performance. Blood thinners don't directly cause erectile dysfunction, but the conditions that require them, like heart disease or vascular problems, often do. And when you add in stress, the cycle becomes stronger. Worry about intimacy, difficulty with erections, even more worry. For women, the issue may be different. Blood thinners don't reduce desire, but hormonal changes after menopause can bring dryness or fragility. Combine that with the fear of bleeding, and suddenly, intimacy feels risky instead of joyful. 4. Embarrassment and silence. Here's the hardest part. Most seniors don't bring up these worries to their doctors. Why? Because intimacy after 60 is still treated like a taboo topic in too many clinics. I've had patients tell me, I didn't want to waste my doctor's time with the silly question. Others say, I was too embarrassed to bring up sex at my age. But here's the truth. Intimacy is not silly. It's not trivial. It's a core part of health and happiness at every age. When it's ignored, fear grows, and couples start to withdraw, not because they've lost love, but because they've lost confidence. 5. The hidden cost of silence. Let's be honest, when intimacy fades because of fear, it doesn't just affect the bedroom, it affects the entire relationship. A wife may feel rejected, a husband may feel ashamed. A couple who once shared warmth may start sitting a little farther apart on the couch. That's the hidden cost of unspoken fears. So where does that leave us? We know the medical reasons for blood thinners. We know the emotional weight they can carry when it comes to intimacy. But now comes the critical question. What does the science actually say? Are these fears grounded in real danger? Or can most couples find safe, fulfilling closeness while on these medications? That's exactly what we'll uncover next.
Act 3. What the science really says. We've talked about the fears. Now let's get to the facts. Because when it comes to blood thinners and intimacy, science paints a much clearer picture than the worries our minds often create. And here's the headline. For most seniors, intimacy is safe even while on blood thinners.
1. What blood thinners do and don't do. Blood thinners, whether it's warfarin, Eliquis, Pradaxa, or Xarelto, don't make your blood dangerously fragile. They don't cause your body to leak blood with every little touch. What they do is slow down clotting. That means if you get a cut, it may take longer to stop bleeding. If you bump into something, the bruise might look darker or last longer. But intimacy itself, especially when it's gentle, does not trigger dangerous internal bleeding in healthy seniors. And here's the headline. For most seniors, intimacy is safe even while on blood thinners. 2. Risks in context. So, when should you be cautious? Let's be specific. If intimacy involves rough physical contact, falls, or pressure against fragile skin, bruising is more likely. If you mix blood thinners with alcohol, your bleeding risk rises. If your INR levels, for those on warfarin, are too high, your doctor may adjust your dose, because that's when the bleeding risk is real. But everyday closeness, holding hands, hugging, kissing, and even intercourse is typically safe. In fact, the American Heart Association and other major medical groups encourage intimacy as a form of healthy exercise and emotional connection, even for those with heart disease and on blood thinners. Number 3. What about erectile dysfunction? Many men assume blood thinners cause erectile dysfunction. Here's the truth. They don't. Erectile problems usually come from underlying conditions, atherosclerosis, diabetes, high blood pressure, that are the very reasons you were prescribed blood thinners in the first place. In other words, the blood thinner isn't the cause, it's often the protector. So instead of blaming the medication, it's better to address the root causes: exercise, nutrition, hormone balance, and emotional confidence. Number 4. What about women's concerns? For women, blood thinners don't reduce desire or pleasure directly, but vaginal dryness or tissue fragility after menopause can make intimacy feel uncomfortable. Add in the fear of spotting or bleeding, and it's no surprise that desire can dip. Here's the good news. Lubrication, gentle pacing, and open communication make intimacy not only possible, but often more enjoyable than before. Number 5. Red flags that need a doctor's attention. Now, while intimacy is generally safe, there are times when you should call your doctor right away. If you notice blood in your urine or stool after intimacy, if you experience prolonged bleeding that doesn't stop, if you develop large, unexplained bruises in sensitive areas, or if you feel severe pain that doesn't fade with rest. These are not normal, and they signal it's time for medical guidance. Number 6. The bigger picture. Here's something I want you to remember. Intimacy is not just physical. It's emotional, psychological, and relational. Science tells us that seniors who remain intimate, whether through touch, cuddling, or lovemaking, often experience better heart health, lower stress, improved sleep, and even a longer lifespan. So the idea that blood thinners mean no intimacy is simply false. If anything, staying connected may be one of the best things you can do for your health. So now we know the truth. Intimacy and blood thinners can safely coexist. But knowledge is only half the battle. The real question is, how do you put this into practice? What steps can you and your partner take to make intimacy not only safe, but enjoyable and worry-free? That's exactly what we'll explore next, with practical tips you can start using tonight.
Act 4. Practical safety steps for couples. By now, you know the truth. Intimacy is not forbidden just because you're on a blood thinner. But facts alone don't erase fear. What really builds confidence are practical steps you can use in your daily life. Guidelines that make intimacy safe, comfortable, and even more fulfilling. So let's walk through them together. 1. Start with open communication. The first step is not physical, it's emotional. Talk openly with your partner about your worries. If you're afraid of bruising, say it. If you feel nervous about bleeding, share it. When intimacy carries fear, silence makes it heavier. But when couples talk honestly, fear shrinks. You'll often find your partner feels the same way, and together you can create a sense of safety instead of anxiety. Try this phrase. I want us to stay close, but I worry about what the medication might do. Can we take it slow? That simple openness can transform hesitation into cooperation. 2. Choose gentler positions. Certain positions may put more pressure on fragile skin or sensitive areas. That doesn't mean passion disappears, it just means you adapt. Side-by-side positions can reduce strain. Using pillows for support helps with comfort. Avoiding positions that put body weight directly on top of a partner can reduce bruising risk. Remember, intimacy isn't about gymnastics, it's about closeness. A slower, gentler rhythm can be just as satisfying, often even more so. 3. Use lubrication and comfort aids. For women, especially after menopause, dryness can lead to friction. Combine that with blood thinners and the chance of spotting or micro tears increases. The fix? Lubrication. A high-quality water-based or silicone-based lubricant can make all the difference. Don't see it as a crutch, see it as a tool for comfort, safety, and pleasure. Men too may benefit from comfort aids. Anything that reduces pressure, enhances circulation, and keeps the experience smooth. 4. Time it wisely. Here's a tip most couples never consider. Timing. Avoid intimacy right after drinking alcohol, since it thins the blood even more. If you take your medication at night and feel dizzy or lightheaded, consider earlier in the day when you feel stronger. Plan intimacy when you're rested and not rushing. A calm body is less likely to bruise or feel strained. Think of timing as part of the ritual, setting the stage for connection instead of letting the medication control the moment. 5. Protect the skin. Fragile skin is more prone to bruising. You can minimize this risk by making small changes. Remove rings, watches, or sharp jewelry before intimacy. Place a soft blanket under you to cushion the skin. Keep fingernails trimmed smooth to avoid scratches. These little adjustments add up, creating a safe environment where you can focus on connection, not worry. 6. Keep the room safe. Sometimes accidents happen, not during intimacy, but around it. A slip on the rug, a bump against furniture, a fall in a dimly lit room. Protect yourself by clearing clutter from the floor, ensuring good lighting, using stable chairs or beds without sharp corners. Because the truth is, a fall in the bedroom can cause more harm than intimacy itself. Safety begins with the environment. 7. Reimagine intimacy beyond intercourse. This may be the most important step of all. Intimacy is not defined by one act, it's defined by connection. Explore gentle massage, prolonged touch, skin-to-skin cuddling, even shared laughter in bed. When you see intimacy as a spectrum, not a single destination, the pressure fades and closeness grows. I once counseled a couple in their 70s. The husband, recently prescribed warfarin, felt terrified of intimacy. He was convinced he'd bruise his wife or cause bleeding. For months, they avoided closeness. Then, step by step, they applied these strategies. gentler positions, better timing, using lubrication, and most importantly, talking about their fears. Slowly, their confidence returned. Today, they'll tell you they are not just safe, they are closer than ever before. So we've covered the practical side, the steps you can take physically to protect yourself. But there's another layer we need to talk about. Because sometimes the biggest challenges aren't about the body at all. They're about the heart, the emotions, and the relationship itself. And that's what we'll explore next. The emotional and relationship dynamics of intimacy while on blood thinners.
Act 5. Emotional and relationship dynamics. We've talked about the practical steps, gentler positions, timing, hydration, and comfort. But let's be honest, intimacy isn't just about the physical body. It's also about the heart, the emotions, and the unspoken connection between two people. And when blood thinners enter the picture, the emotional side often becomes the hardest part. 1. Fear creates distance. Fear has a way of building walls. A husband may avoid reaching out because he's afraid of hurting his wife. A wife may hold back because she's worried about spotting or bruising. Neither wants to reject the other, but silence and hesitation send the wrong message. Soon, one partner feels unwanted and the other feels guilty. What began as love and care turns into distance. 2. The weight of aging and medication. For many seniors, taking a daily pill is a constant reminder. I'm aging. My body isn't the same. That awareness alone can chip away at confidence. Add intimacy to the equation, and suddenly, what once felt natural now feels fragile, like walking on eggshells. It's not just about the fear of bleeding. It's about the deeper fear of no longer being the partner you once were. 3. The confidence equation. Confidence is the fuel of intimacy. Without it, desire struggles to ignite. And blood thinners can indirectly shake that confidence, not because they change who you are, but because they remind you of vulnerability. Here's the truth. Intimacy after 60 doesn't demand a perfect body. It demands presence, trust, and emotional connection. And when confidence feels low, sometimes the most intimate act you can do is simply say, I still want you. I still need you. Let's figure this out together. 4. Redefining intimacy. For some couples, intimacy means intercourse. For others, especially after health changes, intimacy becomes something broader. Holding hands on a walk, sharing a quiet laugh in bed, a gentle massage that eases tension, skin-to-skin closeness without pressure to perform. When you redefine intimacy as connection, not performance, you take away the fear of failure. Suddenly, even small acts of closeness become victories. 5. Communication is the real medicine. Every doctor can prescribe pills, but the medicine that keeps intimacy alive is conversation. Talk about your fears. Talk about your needs. And yes, talk about what feels good and what doesn't. These conversations may feel awkward at first, but they're the bridge back to trust and closeness. Remember, silence builds distance, but honesty builds connection. 6. A story of hope. I remember counseling a couple in their mid-70s. The wife was on blood thinners after a stroke, and intimacy disappeared. The husband assumed she didn't desire him anymore. She assumed he was afraid of her fragility. When we finally sat down together, they cried as they admitted their fears. Then we worked on small steps, holding each other, gentle touch, shared routines. Within months, their spark returned, not because the medication changed, but because their willingness to face fear together did. Their story proves this. Intimacy is never lost unless you stop reaching for each other. So, where does this leave us? We've seen the medical side, the practical side, and now the emotional side. The final step is to bring it all together, because blood thinners may change your body, but they don't have to change your story. In our closing section, I'll share the big picture, the truths you can carry with you, and a call to action that reminds you, life after 60 is more than safety. It's about love, connection, and living fully. We've walked a long road together today through the science of blood thinners, the unspoken fears, the practical safety steps, and the emotional side of intimacy. And if there's one message I want you to take away, it's this: blood thinners may change your body, but they don't have to take away your closeness, your confidence, or your joy. 1. Reclaiming the bigger picture. Yes, these medications protect your heart and prevent life-threatening clots. That's something to celebrate, not fear. But they also raise questions about bruising, about safety, about intimacy. The bigger picture is this: with awareness, adaptation, and open communication, you can keep intimacy alive, safe, and deeply fulfilling. 2. 3 core truths to carry with you. Let me leave you with 3 truths you can hold on to. 1. Intimacy is safe for most seniors on blood thinners. The risks are real, but manageable. 2. Connection matters more than performance. Intimacy is about closeness, not perfection. 3. You are not alone. Millions of seniors take blood thinners, and millions of couples have found safe, joyful ways to stay close. A word of encouragement: you are not defined by a prescription bottle. You are not defined by bruises or by fear. You are defined by your spirit, your love, and your willingness to keep reaching for closeness. Even after 60, intimacy can still be vibrant. It can still be joyful. It can still be yours. Action steps for today. Here's what you can do right now. Share your worries with your partner out loud, not silently. Take one small step to adapt, whether it's adding comfort, timing intimacy earlier, or simply holding each other longer. And if you're unsure, bring your questions to your doctor. Remember, intimacy is part of health, and it deserves the same attention as your heart or your blood pressure. If today's conversation helped you, I invite you to join our community here at Men's Vital Health. Please like this video so others can find it. Share it with a friend, a spouse, or anyone who may need hope. And subscribe to our channel so you never miss another conversation with me, Dr. Emily Carter. Every week, we bring you real talk, expert insights, and compassionate guidance. Because health after 60 is about more than just surviving, it's about thriving. So as we close, remember this: blood thinners may protect your heart, but love is what keeps it beating strong. Stay close, stay safe, and never stop believing that intimacy belongs to every stage of life. I'm Dr. Emily Carter, and this is Men's Vital Health. Thank you for watching. Stay well, stay connected, and as always, live with vitality.